I'm gonna walk in, provide privacy, hand hygiene. Hey, my name is Caitlin and I'll be taking care of you today. Can you verify your name and date of birth for me?
Chris Mayo, 7/25/2002.
Okay, that matches good. Do you have any allergies I need to know about?
Nope.
Okay. Well, I'm gonna do a partial head to toe assessment on you today, if that's okay.
That's fine.
All right, and I have already taken his vitals. His blood pressure was 118/78. His pulse rate was 68, and his respirations were 16, which is all within range. So I'm gonna start by asking, if you've been in any kind of pain?
I have not.
Okay, good. Well, I'm gonna start doing your respiratory system, your respiratory assessment, okay? So I'm gonna start with your lung sounds, but before we do that, can you tell me, have you had any shortness of breath or any trouble breathing?
I have not.
Okay, have you had a cough?
Nope.
Okay, well, I'm gonna start, I'm gonna listen to your lung sounds, and I'm gonna listen 4 anteriorly, 2 lateral, and 4 posteriorly, and that will be in the lobes of the lung. Okay, and in a healthcare setting, I would actually put diaphragm to skin, but for the video's sake, I'm gonna do it through his shirt. All right, and take a deep breath every time you feel a stethoscope, okay?
Mm-hmm.
Okay, can you lean up for me? All right. Thanks. All right. There were no adventitious breath sounds. All lung sounds were clear, so that's a good thing. Have you ever used an incentive spirometer?
I have not. No.
You have not. Okay, well that's what that is right there, if you mind grabbing that for me. So what this does is, I know when you look at it, you want to breathe into it, but you are going to breathe out. You're going to breathe, you're going to inhale using it. So if you put it to your mouth, and then you're going to see how high you can make this centerpiece go to. Okay, good job. So what this does is it helps expand your lungs and prevent pneumonia. And also, you need to do that 10 times an hour, every hour that you're awake.
Okay.
Okay, and then another technique to use is to turn, cough, and deep breathe. And doing that, it helps clear out your lungs, and it's also aiding in preventing you from getting pneumonia as well.
Okay.
Okay. Now we're going to move to your cardiac. So I am going to listen to some some heart sounds, okay? But first I'm going to ask you, have you had any tightness or pain within your chest?
Mm.
No? Okay. All right. Right now I'm going to listen for, look for JVD. So what I'll do is get you to slide down in your seat about 45 degree, at a 45-degree angle. And I'm going to ask you, I'm going to use a pen light, and I'm going to ask you to turn your head that way. And I'm going to observe for any jugular vein distension. Okay, there's none present, so that's a good thing. And now I'm going to I'm going to show where his pulses are. And earlier when I got 68 on his pulse, I used his radial. But you're going to start up here, and this is your carotid. And down here is your axillary. Then you have your brachial. And again, this is your radial. And then your apical is right here. Then you have femoral. Behind the knee is the popliteal. and by the ankle is your posterior tibial, and on the top of the foot is the dorsalis pedis. And when you're checking your apical pulse, you're always going to do it for a full minute. Okay, so now I am going to listen to your heart sounds.
All right.
Okay. Goodness, should have wore my hair up. Okay, so I'm gonna start on the right second intercostal space is his aortic, and then I'm gonna come to the left second intercostal space, and that is his pulmonic, and then I'll go to the third intercostal space, and that's Erb's point. And then I'll go to the fourth, that's tricuspid. And then I will go to the fifth intercostal space, mid-clavicular, and that is his mitral. And it's also the apex of the heart and where you would observe for his apical pulse. Okay? And again, for video purposes, I'm going to do it through his shirt, but in a regular cardiac health assessment, you would do it diaphragm to skin. And what I'm listening for is S1 and S2 sounds, and that is with the diaphragm. And I would flip it over and use the bell of the stethoscope if I have heard any S3 or S4 sounds, which are abnormal heart sounds. Okay. Okay, and in a real assessment, you would listen to the apical pulse for a full minute. And now I'm going to, everything sounded good. There was an S1 and S2, and there was no S3 or S4 that seemed present. So now I'm going to check for edema on the upper and lower extremities. So I'm going to start with at his feet. So if you'll hand me this, and I'll just feel all the way up and feel for any edema. There's no edema. You would do it bilaterally. No edema. And then you would move to the arms, starting at the fingers and hands. Okay, there was no edema present, which is a good thing. And I forgot to mention that on your pulses, every pulse but your carotid, you would also check bilaterally to confirm each other. So that is all for cardiac. And now I am going to move to your neurological and musculoskeletal and your head, ears, eyes, nose, and throat assessment. Okay?
Okay.
So I'm going to start by asking if you can verify your name and date of birth again.
Chris Mayo, 7/25/2002.
Okay, do you know where you're at?
My house.
Okay. Do you know why we're doing this assessment?
Check up.
Okay. All right, so he is alert, awake, and oriented ×4. So now I'm going to start with the head. And so I'm going to look, and I'm going to ask you to take your hat off. Okay. And I am inspecting his head for any lesions, abrasions, anything that may be present. I'm checking to ensure that his head is symmetrical and normocephalic, and everything looks good there. Have you had any issues with headaches or anything of that sort recently? No? Okay. So that is good. Now moving to the ears. I'm checking. I'm going to stand in front and I'm going to inspect to ensure that his ears are of even height, in even size, and that they are symmetrical. Have you had any issues hearing or any hurting of your ears or anything?
Nope.
Okay, well, I'm gonna ask you to stand up for me real quick. And I'm gonna whisper a word on either side of you, and I want you to repeat the word to me, okay?
Alright. Blue.
Okay?
Purple.
Okay, very good. So that was the hearing test. And now I'm gonna go to your eyes. Looking at your eyes, they are symmetrical. Doesn't seem like there's any issues. You haven't had any swelling, redness, or watering of the eyes, have you?
Mm-mm.
No? Okay. So I'm going to check for perla now. So I'm going to shine a light consensually and directly. I'm going to observe for the constriction of his pupils. Okay? Okay. Okay. And now for accommodation, I'm going to have him look at this pen light. Then I'm going to have him look to the wall above me and back at the pen light, and I'm going to observe the motion of his pupils. Okay, look at the wall. Be back at the... All right, so everything is good there. His pupils constricted, and they were about a size 2. Okay, so now we're going to move to the nose, and I'm going to ask you to occlude one nostril and inhale. See if you can smell. Okay, and then do the other side. Okay, everything is good there. I'm going to check inside your nose. Everything looks fine. Everything's good. The nose is symmetrical. There's no crookedness to the nose. Okay, and now I'm going to move to the mouth. Or have you had any trouble smelling or anything like nose stopped up? You need occlusion to the nose?
Mm-mm.
Okay, so now we're going to move to the mouth, and I'm going to check for dentation or dentition. I'm going to check to see if there's any loose teeth or anything of that sort. Okay. Okay, there's no loose or missing teeth. The gums are pink and moist. Everything looks fine on that. Okay. Now, have you had any trouble with taste or any hurting teeth, any loose teeth that you felt? No. Okay. So now I'm going to move to your throat, and I'm going to assess the trachea. I'm going to look at the trachea, and it is midline. There's no deviation to the trachea, which is a good thing. And then I'm going to ask you to swallow. Okay, he can swallow. That's good. Have you had any sore throat or any like pain in your throat at all?
I haven't.
You haven't? Okay, well, good. Now we are going to move into our musculoskeletal
Okay.
assessment. Okay, so I'm going to do 2 upper joints, and then I'm going to do 2 lower joints, and then I'm going to do them with some resistance, and we are going to test the strength of each joint. Have you had any pain in the joints, any trouble walking or anything of that sort?
Mm-mm.
Okay, so I'm going to start right here with the elbow, and I'm going to cup the elbow, and I'm going to ask you to flex it for me. Okay, you can do that. I'm going to ask you to extend it and then hyperextend. Okay, that's good. I'll do it with a little bit of resistance. Okay, no problem there. All right, moving down to the wrist. I'm going to kind of cup it. I'm going to ask you to flex. Then I'm going to ask you to extend again, okay? And then I'm going to ask you to hyperextend, okay? We're actually going to flip it over and try it. And I'm going to ask you to, with a little bit of resistance, I'm going to ask you to flex, okay? Then extend, and then hyperextend, okay? No problem there. Moving down to the knees. I'm going to do the same thing. I'm going to cup your knee, flex it for me, okay? And then extend it. All right, with a little bit of resistance, do the same. Okay, extend it. Then moving down to the ankle. So, or the foot. Can you plantar flex the foot for me? Dorsiflex it, okay? With a little bit of resistance. All right, good job. Now, can you stand up for me? We are going to assess your gait. If you will, just walk to the edge of that couch for me and back. Okay, no issue with the gait. Okay, now turn around and walk back to the couch doing the tandem walk, which is heel to toe. Okay, good, you can come back. Now, if you will, stand in front of the camera. And I want you to turn this way for me. Hold your arms out, feet together, eyes closed. All right, and your balance is good, so everything seems to be fine. You may sit back down. Is there anything I can help you? Anything else I can help you with?
I don't think so. No.
Okay. Well, thank you. I'm glad you came in to see us, and you have a good report.
Thank you.
Thank you. Have a good day.
You too.